I'm delighted to be joined today by Jamie Ray-Leonetti, Associate Director of Policy of the Institute on Disabilities here at Temple University. Ms. Ray-Leonetti holds a JD from Temple's Beasley School of Law and brought with her to the Institute on Disabilities her 20 years of professional experience serving as an advocate for individuals with disabilities throughout Pennsylvania. Given the large impact that the current COVID crisis is having on people with disabilities, their care partners, and policy, it is very fitting that we are having this conversation today, and I'm very grateful to you for joining us, Jamie.
Thanks so much, Judith. I'm glad to be here.
Great, thank you. Before we turn to our discussion of COVID, could I trouble you just to describe a little bit the work of the Institute on Disabilities?
The Institute on Disabilities is housed within the College of Education at Temple University, and our interim executive director is Sally Gould Taylor. The Institute on Disabilities is one of 67 university centers for excellence in developmental disability. So each state has at least one, what we call UCED for short. In Pennsylvania, we have the privilege of being the only university center for excellence in developmental disability. So although we're housed on Temple University's campus in Philadelphia, we provide services to families and individuals across the entire state of Pennsylvania. Our work focuses on education, training, research, and helping to develop the next generation of leaders in disability work.
Wonderful. It's fantastic that you were here at Temple, and a great honor to the university. Turning now to the COVID crisis, what do you see as the big challenges that people with disabilities are facing in this time?
Well, I thought a lot about this question, Judith, and I think it's fair to share that I myself am a person with a physical disability, and that my husband experiences disability as well. So this question is very personal to us. In addition to the work that I do and the families and people that we serve. So I tried to narrow it down to just a few things that are like what I see as being key to this pandemic problem. And what we've narrowed it down to is access to healthcare and access to equitable healthcare, the ability to simply social distance to be safe during the pandemic. Right. And then last, the ability to access goods and services that others might take for granted, such as food, medication, transportation, those types of things.
Let's talk a little bit more about support services. How are they impacted? What services are able to operate during this period of physical distancing, and what kinds of services have been interrupted?
So that's a great question, Judith. Many people with disabilities use services and supports to help make them as integrated as possible into their larger community. So that could be an activity or a job that they go to during the day. It could be services that come into their home to assist them with activities of daily living, as well as community integration or work. So services and supports are used both in the community and also in the home. So what has happened during the pandemic is a few things. First, many of the provider type programs and services that people might have been using, like bricks and mortar places where someone might go, had to almost immediately close in the face of the pandemic. So people who may have attended these programs during the day suddenly found themselves at home with family members, friends, neighbors, basically whoever was available. So that was an immediate need. And the Office of Developmental Programs and other state agencies had to respond to that by sometimes trying to shift staff who may traditionally work in a program to have them come and provide support in the home or even provide virtual support, because sometimes coming into the home was not practical. The other issue that became immediately apparent in the face of the pandemic was the whole issue of access to staff. So, for example, someone might be used to having 7 hours of staff support during the day, and maybe that's 2 or 3 different trained professionals who provide that in-home support. What if one of those individuals suddenly becomes ill and is not able to work? What if you yourself are not comfortable having somebody who is not a member of your immediate family come into your home on a regular basis all of a sudden because we have this COVID and we don't know what all of the ramifications of that are, and we know that we're supposed to be socially distancing. So striking that balance between social distancing and getting the support that one needs was suddenly a big problem and a big concern, and we had to rethink some things really quickly.
For those who once used services that have closed down during lockdown, you talked about sort of some of the alternatives that people are using. Are there people who are simply going without services that they really do need?
We know that there are some people who may be going without, and of course that is a big concern. We try to limit that as much as possible by looking at alternatives. Some of the alternatives, I mentioned remote support, and that's been a big change for the Office of Developmental Programs, the Office of Long-Term Living, and other state agencies. And in fact, those agencies, when the pandemic began, had to seek what we call variances to the waivers. It's technically called Appendix K, but in a nutshell, it's a process to basically have remote support be a possibility. So rather than having a support person have to physically come to the home, maybe they jump on Zoom with the individual who needs the support. And much like you and I are interacting right now, we would talk or engage in an activity, whatever that particular person needs. So that's one way that things are being handled. Another way that things are being handled is through the support of family, so what we call natural supports. So suddenly mom or dad or sister or brother may be responsible for providing the supports that would normally be provided by a staff person. That's another possibility.
Mm-hmm. What's happening? We hear a lot about the scarcity of personal protective equipment, or PPE. What is happening in terms of support services having access to PPE?
Well, there are at least 2 different kinds of supports, but 2 different kinds that I'll speak about. The first are direct support professionals who may work directly for an agency. Those individuals have been in the good position to be provided some PPE by their agency in most cases. In cases where the agency maybe was too small or not able to provide PPE, the Office of Developmental Programs and the Office of Long-Term Living also stepped in to assist with that. And of course, there have been donations from various places and entities across Pennsylvania, which we are very thankful for. Some of those donations, I believe, even came from Temple University. So then there are also providers, well, I should say individuals, excuse me, individuals who work directly for the person with a disability to provide services in the home. So they are not connected directly to an agency. It has been really difficult for those individuals and families in some cases, particularly in rural areas, to get the PPE that was necessary. We've had to do a lot of educating with both our state legislature and also with the federal legislature to express to them the need for PPE. And finally, in one of the COVID relief packages, there was some provisions made to get PPE to these folks. So that's been very important.
That's good to hear. What about testing? Has testing been sufficiently available?
The longer that we go into this pandemic situation, the more important it seems and the more focus there seems to be on testing. Again, testing is variable in the sense that some people may have access to testing while others do not. The exception to this would be now in our nursing and other congregate care settings. Of course, Governor Wolf recently signed something that requires COVID testing for all staff and all individuals residing in our 600 plus nursing facilities across the state of Pennsylvania. Now, that's great, but people with disabilities, we know, want to live in the community. We know that they thrive to a greater extent when they live in the community compared to living in a congregate setting like a nursing home or a state center for intellectual disability. So we remain concerned that there's now required testing in congregate facilities, but the same access is still not available to the larger community.
Clearly, having one's physical needs met is crucial, but the current circumstances have also brought so many changes to everyone's lives that have emotional impact. Can you talk about those emotional effects for people with disabilities and how they may be unique?
Well, first of all, I just want to recognize that we're all feeling it, I think, regardless of whether we have a disability or we don't have a disability or what that disability might be. Right. But you are correct that there are some unique challenges for people with disabilities. For example, people with intellectual disabilities or developmental disabilities may experience more difficulty understanding what's going on with this pandemic. For example, if they're used to going out every day, why all of a sudden do we have to stay home? Why do we have to socially distance ourselves? Why do we have to suddenly wear a mask when we're out? These are all things that could be potentially difficult. And I think we are lucky both at the Institute and also with some of our community stakeholders that we work with, such as Vision for Equality, Disability Rights Pennsylvania, PA Family Network. We have recognized the need and have been able to offer some Zoom educational opportunities and things like that to help individuals with intellectual disabilities and families explain some of these things that may be new or difficult. So that's certainly one issue. Another issue in this same category would be the whole idea of the mental health issues that may come from social isolation. So, you know, again, if a person with a disability is used to getting out and about on a regular basis, or they're used to a certain activity, or they're used to going to work, and suddenly they're told, no, you need to stay home. And not only that, you can't really have guests over. I mean, if you need support, that's one thing, but guests are totally another thing. What do we do about that? So we've also found ourselves needing to get technology into the hands of people with disabilities who may not have necessarily had it before the pandemic. And I want to give a big shout out to one of our programs at the Institute. We house a program known as TechAL, which is Pennsylvania's assistive technology program at the Institute. And our TechAL team immediately jumped on this need and have been able to access some purchased as well as donated equipment, and they are now cleaning and sanitizing that and actively getting it into the hands of people with disabilities and also seniors across Pennsylvania who need, for example, an iPad or a hotspot in order to make a connection with folks who are outside of their home.
That sounds like a terrific program. And obviously we've seen the technology. I mean, right now, you and I are having this interview because we both have devices and Zoom. And so it can make a huge difference. So I'm really glad to hear that's happening.
Yeah, a few months ago, we never would have thought we'd be doing this way, right?
No, we absolutely would not have. This situation, as well as putting a lot of stress on people with disabilities, have also put a lot of stress on people who work with them, a lot more responsibility and difficulty for care partners. Can you talk some about how they are faring?
In my work, one of the projects that I work directly on is called Person-Directed Services. And person-directed services is the whole idea that a person with a disability can make choices about and direct their own services and supports. So that means planning what their day is going to look like, planning what their goals are, hiring and firing and training, and really working directly with their own support staff. So that has been a challenging area for many families and individuals with disabilities, but it's also been a great opportunity for some of these same people. So maybe we've had several instances where someone was used to going to a particular agency's program during the day. And of course, in the pandemic, that program shut down. The individual goes home. Now what do I do with my day? Well, now's a good time to explore things like, do I really need to go to the four walls of that program in order to spend time with my friends or in order to have social interactions? Or can I really connect with those people using my iPad? And maybe there's a virtual exercise group that meets on Tuesdays that I want to become involved in. And there's an art class on Wednesday that I think I'm interested in. And if I have the right support here at home, maybe I can just build my day that way. So we have seen people shifting away from traditional agency model and over to the person-directed services model, which is great. Now, of course, that does come with responsibility. And you asked, how is this impacting care providers, care partners? Well, it's impacting care partners probably much like it's impacting the rest of us. I mean, there are so many balls to juggle, whether it be that you now are providing support to this individual with a disability, and maybe you also have work from home responsibilities, and you have 3 kids that are now doing teleschool. So all these things are going on. But there are free services and programs available to people to help support that. I think one of the big things to keep in mind is the whole idea of trauma-informed care. I mean, this whole pandemic situation, not to mention the other types of social injustices that we're currently facing, is trauma. We might not think of it that way initially, but I think that people may be feeling the impacts of these things for quite some time to come. So we've tried to encourage people to take advantage of things like meditation, yoga, exercise, just the benefit of going out and taking a short walk or a roll, even if it's in your neighborhood. And again, shout out to one of our community partners, Vision for Equality, because they have a great example of this. They've offered a mindfulness class online. They've offered virtual Zumba classes to folks and also virtual yoga. So there are ways to get the need met. It's just important we recognize it.
What's happening if a care partner should get COVID? How is that working out?
It really depends on the circumstance that the person finds themselves in. I mean, I've talked a lot about people who are receiving waiver services today and are able to access services and supports using those waivers. But we also have about 13,000 individuals approximately throughout Pennsylvania who have intellectual disabilities who are on what we call the intellectual disability waiting list. Now, this list exists because there are not enough waiver slots available for every person identified as having an intellectual or developmental disability in Pennsylvania. But steps have been taken over the last several years to really reduce the waiting list. So even though we still have 13,000 people on it, which is nothing to sneeze at, it has gotten smaller and we continue to work on that. The thing is, the 13,000 people who are at home, quote, waiting, are not really waiting. They're at home getting the services and supports that they need through natural supports, whether that be mom and dad, sister or brother, what have you. And the question becomes, what happens if that care partner becomes ill, either with COVID or for another reason? So what we have found is a couple of things. One, the Office of Developmental Programs has attempted to put in place some emergency provisions so that if that were to arise and there really was no care partner for the individual at home anymore, can we find a different way to deal with that? So, for example, could we use some funding to move that person temporarily to another location and provide them support so that they can get through the COVID crisis? But what we remain concerned about is if funding is not available, or if someone does not know about the individual and their current situation, will that individual who now does not have a care partner be moved into a nursing facility or some other type of congregate setting because maybe the medical professionals, you know, that's the only option that they see. So we really have been trying to keep a very close eye on that and ensure that that does not happen in the community.
This whole crisis has highlighted our, really gross inequalities in the work arrangements that different kinds of workers and professionals have. Can you talk a little bit about direct support workers and professionals? What kinds of benefits they have that are helpful in this crisis? I mean, most notably paid sick leave. Can you talk about the landscape there?
We have what we call a direct support crisis in Pennsylvania and also on a national level. And what we mean by that crisis is that there are not enough trained direct support professionals and support service professionals to provide the services to everybody with a disability in Pennsylvania who wants them or needs them. Part of the reason why the numbers are low and there are high turnover rates among direct support professionals and support service professionals is that despite the very important, very essential nature of their job, many of them are paid an extremely low wage. I mean, I can't give you an exact average, but some support service workers are paid like $11 an hour. If someone is paid $14 an hour, that's an extremely good rate. So you can see what we're competing with here. Basically, a person who works as a direct support worker could go to Target or Walmart and potentially get a job that pays them a higher wage than what they're receiving to provide the care. We're lucky because many of them do recognize the importance of their job and they do the work not necessarily for the rate of pay that they're receiving, but because it's their passion. And of course, those are the kinds of direct support professionals that you want, but direct support professionals need to be paid a fair and living wage. Also, many direct support professionals do not have paid sick leave. Now, in Philadelphia, it's a little bit different because we have some local ordinances that require paid sick leave. Also, we have some agencies where the direct support staff are unionized, and through that process, they're able to get some paid sick leave. But really, the situation is not great for them. And part of the reason why we've started to shift language to refer to these individuals who provide this essential service as professionals is because we believe that they are professionals and they should be treated as such. Now, with COVID, there have been some things put into place. So, for example, in one of the first COVID relief packages, that included things like the Paycheck Protection Act. So that allowed agencies that hire direct support staff to keep that staff on, and in some cases also to provide the staff with things like hazard pay, temporary increase in their hourly rate, PPE, and also in some instances, at least some money to assist with transportation, which was particularly important during the time when public transportation systems were shut down.
Yeah, it's been very interesting to see what I sense as a shift in the realization and appreciation of the skill that goes into many jobs that are deemed low skill, and also the real importance of many jobs that lots of people took for granted. So it'll be interesting to see if this new appreciation translates into long-term changes in how jobs are rewarded, or what the work arrangements are. Well, I guess that's yet to be seen. The vast majority of direct support workers and professionals clearly are very committed to this work and are doing it with great care. There has been some concern that the situation that we're all in lockdown and the incredible level of stress that it produces could potentially lead to some incidences of abuse or neglect. Is that something that you worry about?
Of course we worry about that. I mean, that's something that the disability community has unfortunately had to face and worry about for years. And I don't think that that will be ending anytime soon. We always have to keep our eye on potential instances of abuse and neglect. Now, we are lucky in the sense that one of our Developmental Disabilities Act partners is Disability Rights Pennsylvania. Disability Rights Pennsylvania is, of course, our state protection and advocacy agency. And there's a protection and advocacy agency in every state, just like there's a University Center for Excellence in Developmental Disability in every state. It's really the job of the protection and advocacy agency, so Disability Rights Pennsylvania, to monitor for instances of abuse and neglect. And I can tell you that they have certainly been doing that during this pandemic, and they've had to come up with new ways of doing that, including some remote monitoring techniques. So we're very thankful to the good work of our P&A. We also have in Pennsylvania what we call IM4Q, which stands for Independent Monitoring for Quality. The Independent Monitoring for Quality program is one of the programs of the Institute on Disabilities. And what that program does is interview individuals with intellectual and developmental disabilities and sometimes their family members or care partners to ensure that they are living the everyday life that they want to be living. And of course, as part of that process, to ensure that abuse and neglect is not taking place.
You mentioned sort of at the top that one of the big concerns is people's ability to get physical goods that they need, things like groceries, medications, equipment, other things that are important. Can you talk a little bit about how people with disabilities are faring and being able to get these kinds of goods?
An interesting thing happened with the onset of the pandemic. So for years now, my husband and I, for example, have used online grocery shopping, whether it be through Giant or ShopRite or whatever, to get our groceries delivered, because it's quite frankly much easier than trying to go to a grocery store and physically get those groceries home and back to your house, etc. Now, many people with disabilities use this service, and it's kind of like common to us. But what happened during the pandemic was that other people, lots of other people, started using these online delivery services as well. It was like it was discovered all of a sudden. And then people with disabilities found, oh my gosh, I can't just get on here and order the food and supplies that I need, because there's actually a waiting list to get a delivery. So we've all kind of had to change the way we think about how we access our food and other goods and services. The other thing that's been somewhat problematic, of course, is the whole concept of accessing medication, where normally you would just show up at the drugstore and potentially pick it up. Maybe you're not in a position where you feel comfortable doing that anymore. So the question is, how do you get those medications that you need? Luckily, many pharmacies are offering contactless delivery services or delivery by mail. So people with disabilities are finding that they need to take advantage of those options as well.
Are there aspects of the stimulus and aid packages that are particularly helpful to people with disabilities? You've mentioned one or two things along the way as we've been talking.
Of course, the whole idea of getting care partners designated as essential workers is very important, because that's how they get access to things like hazard pay, paid sick leave that they might not otherwise have, etc. But there is an area that we are still really pushing for in the stimulus package. The upcoming stimulus package, which has passed through the U.S. House and is now waiting to be considered by the U.S. Senate, is called the HEROES Act. And it's called the HEROES Act because it's really designed to address many of these remaining issues around support professionals, essential workers, the medical field, etc. One of the things that's in that package is additional funding for home and community-based services, or what we call HCBS. Now, home and community-based services are those services that are waiver funded. So the supports that we talk about people getting in their home and in their community are these HCBS services. So the reason why we want and need to see additional funding there is because with the pandemic, we may have more people needing to use those home and community-based services than before. For example, there may be someone who they have a disability, but they didn't have the need for HCBS services, but perhaps they become ill with COVID and they're in a lengthy recovery process. Well, how do they get the services and supports that they need without having to go into a congregate care setting to receive those, if what they want to choose is to live in their community? Well, they get those services through HCBS. So we need there to be extra dollars there to support that. Extra HCBS dollars can also be used to provide some of the things that we've spoken about, which would be things like additional hazard pay or supplemental pay for direct support professionals and direct care workers. Leave programs, things like that could also be funded in the case of this pandemic under those dollars.
We're also in an election year. There are all sorts of issues about mail-in ballots, et cetera. Looking forward to November, what are some of the key issues around ensuring that people with disabilities have access to voting.
There is a very famous and well-loved figure in the disability community whose name is Justin Dart. And many people may know that Justin Dart was basically referred to as the father of the Americans with Disabilities Act, because he was very instrumental in getting the first President Bush to sign that act. And in fact, he's the guy that you see in the picture of the signing of the ADA who's sitting there wearing the cowboy hat. Justin Dart, unfortunately, passed away and left us a few years ago, but he also left us with some very important words of wisdom. And one of those quotes from him is, "Vote as if your life depends upon it, because it does." And I think that that quote really says a lot about the world that we're living in right now. But as we move towards November, people with disabilities need to know that there are new options for them to be able to vote in Pennsylvania. So even with this primary election, we have the mail-in ballot. You're going to be able to get a mail-in ballot to vote in November as well if you choose to do that. And now mail-in ballots are available to everyone, so you don't have to have a particular reason why you need that mail-in ballot. Now, there are issues with the mail-in ballots that you may have heard about, particularly accessibility of the mail-in ballots for people who may be blind or have low vision. And that is an issue that, again, our partners at Disability Rights Pennsylvania have taken up and have had some success with getting some changes to the mail-in ballots to make those ballots more accessible for individuals who are blind or have low vision. I want to remind everyone that Disability Rights Pennsylvania does operate an election day voter rights hotline. So if you have any problems voting either today or in November, you can contact Disability Rights Pennsylvania and they will assist you. So that's important to know. And lastly, you know, it doesn't matter who you vote for. It just matters that you get out and exercise that right, because people with disabilities are a voting bloc and our representatives need to know that.
We've been talking for most of this interview up until we started talking a little bit about November. We've been talking mostly about the current situation, kind of while we're in many people in the country are in some form of lockdown or stay-at-home order. But what about longer term effects, and particularly the economic effects on health agencies, other support services, or other advocacy organizations? What do you see as happening in terms of funding and the economic viability of these kinds of organizations?
Well, this is certainly a concern. And while we don't have a crystal ball, we at least know a few things. We know that there are some providers, particularly smaller providers of support services for people with intellectual and developmental disabilities, who may not survive this pandemic economically. We certainly hope that they do, and we are appreciative of the legislation so far that has been put in place to help financially assist them during this pandemic, but we just don't know. So we need to be prepared for that. One way that we try to be prepared for that is by looking at the possibility of using other providers. So we want to make that information available to families and people with disabilities. But even beyond that, we also want to emphasize the possibility of person-directed services and supports. Because if you're using person-directed services and supports, you essentially become the employer of your own staff. Therefore, you don't need an agency, whether it be big or small. So that's always a possibility. It may be a new possibility for some people, but we shall see. I know that the Office of Developmental Programs has worked very hard through Appendix K and other avenues to make sure that our provider agencies continue to be able to function during this very difficult time. And we certainly appreciate that as well.
You've mentioned one or two policies that you see as important to advocate for during this time and beyond. Are there other policies that you have on your mind that you would like to see get implemented?
Well, there are two big policies that we haven't talked about yet that have come directly out of this whole pandemic experience. And the first policy is that of what we call care rationing or crisis standard of care. And then the second policy would be hospital visitation. And these are two really big issues that came up almost immediately as the pandemic hit. In terms of the crisis standard of care, each state is required to have a crisis standard of care, which basically would outline if we are faced with a situation where, for example, our state does not have enough intensive care beds, for example, what is the order of priority? Who is going to receive those beds? Who is going to receive the care? And this is why at the beginning, when you asked me, what are the big things that people with disabilities are facing, I said access to health care. Because the access did not initially start out to be equitable access. When Pennsylvania came out with its initial crisis standard of care, people with disabilities and other underlying health conditions were basically at the bottom of that level of care. So they might be the last people to receive support services that they need or care in a hospital setting that they need. Immediately, advocacy organizations jumped on this, not just in Pennsylvania, but on the national level. And at Institute on Disabilities, we were very pleased to join in the advocacy efforts of Disability Rights Pennsylvania and to sign on to a complaint that they filed with the Office of Civil Rights, challenging Pennsylvania's emergency care plan. And as a result of all of those advocacy efforts, the crisis standard of care in Pennsylvania has now changed. And there are reminders now in that crisis standard of care that because of things like the Americans with Disabilities Act, we can't discriminate against people when deciding who's going to get care and who's not going to get care simply because somebody may have some type of underlying condition. So that has been a big area of focus in terms of policy. So there's that. And then there's the whole idea of if a person with a disability does need to go to the hospital to receive care for COVID or because of some other reason, we know that the general rule right now is that the only people permitted in the hospital or in the ER are those people who need the care, at least in the red phase. So what does that mean for a person who may have an intellectual disability or a communication disability who, in order to fully understand and fully be able to participate in their care, they need the help of either a family member who knows them extremely well or a direct support professional. When things first started, hospitals were saying, no, you can't come in, direct support professional, family member. It's just the person with the disability who's allowed to come in. And that is another area where we had to, and many advocacy organizations across the state jumped in and said, no, we're not going to stand for this because our community needs to have the same access as other people. So we have been able to address that now. And there is language in a statewide hospital visitor and support policy that says that hospitals need to provide reasonable accommodations and allow support people in.
And has that been, as far as you know, has that been implemented properly? As we know in the policy world, it's one thing to have a policy or a piece of legislation passed, and it's another thing to have it implemented on the ground level. What are you hearing about that?
Very true. I would say that initially complaints were still being raised, and those were able to be addressed, though, which was a good thing. I don't think things are perfect at this point. And I know that some families are still struggling, particularly if they need to access maybe a smaller hospital or healthcare setting that may not be aware of some of these changes. But we continue to advocate. I know Disability Rights Pennsylvania continues to run a care rationing hotline that people can call if they face being turned away at the door of the hospital or have other issues. So those things are positives, but the struggle is a real struggle.
Right. I do imagine the information is hard to, in a rapidly changing landscape, it's hard to make sure that everyone has the information of what the current protocol is. Well, we've talked about a lot of different things, and I think you did absolutely illustrate that it is true that this crisis is having impacts in many different ways on the disability community. Is there anything that we didn't touch on that you feel is important to mention before we thank you?
Well, there are so many important things, Judith, and I so appreciate this opportunity to highlight some of them. I guess if I were going to share one thing, it would be that I hope that what we have all went through with the COVID situation does continue to highlight the importance and the essential nature of direct support professionals, support service workers, care partners, because these are people that individuals with all kinds of disabilities rely upon every day to live the life that they want and to be productive and integrated members of society. So maybe some good that can come out of COVID is shining a light on the need to support those workers.
Well, I certainly hope that does come to be a positive outcome of a very difficult situation. I want to thank you. I really appreciate your taking the time. I know you're incredibly busy and doing really important work, so I really appreciate your taking a little time out to talk with us. And I wish you well, both professionally and personally, as we navigate these very complicated situations.
Thank you for the opportunity, Judith. You stay safe and well.
You too. Thanks so much, Jamie. Take care.